Good. All right. Let's start. Okay, the
Okay,
first question.
so the laboratory parameters of 42-year-old men are plasma prolactin and cortisols are decreased, and
Okay.
urinary 17 ketosteroid excretion is also decreased, and plasma prolactin level is not influenced by the TRH.
Uh-huh.
Administration of the HCG increased the urinary excretion of the 17 ketosteroid.
Mm-hmm. So,
So here we can assume that as the prolactin and cortisols are decreased,
okay.
so is means the hypofunctions of the pituitary because prolactin
Exactly.
and the
Exactly.
pituitary
Yes.
is affected by ACTH, so it could be also decreased by the hypofunction of the pituitary.
Okay.
However, we see the 17-ketosteroid is the marker for the hypogonadism. It
Okay.
can be decreased by the FSH or LH as well.
Yeah, but if you don't have any LH-FSH, for sure you won't have any kind of metabolite of androgens. So
Mhm.
this only is asking, yes, that's a central type of hypogonadism. All right. So in case
Right.
of the central type, we do have a problem with the pituitary. In the peripheral type, we do have a problem with the gonads. These are
Bonus.
the
So,
two different things.
we should distinguish either is primary or secondary.
Exactly. Exactly. So
So,
that's a secondary one, or it's
because
called central hypogonadism.
uh-huh.
Okay. That's a
Okay.
simple question. Okie dokie. Next one, Lydia.
Can I
Yes,
ask?
why
Yeah.
not?
So for the diagnosis, so it can be hyper. So that's the what is the diagnosis? Because some are says that it's panhypopituitarism, but it looks like all of the hypopituitary hormones are absent at the case. So
Yes, it can be a panhypopituitarism. It can be. So it's be
does it
very
also include? So it also includes the GH hormone. I mean growth
yes,
hormone as
yes,
well.
possible. But in the elderly one, in 42 years old, doesn't see
Doesn't
so
seem.
many symptoms. Maybe you have a little bit more LDL, cholesterol level, maybe less body density, body mass density, but pitch voice, but nothing too much.
Mhm.
Nothing too much. In children, yes, you do have, let's say, the linear growth stopped, but not here.
Okay.
Okay, now let's see the next one.
It's me.
Yes, Lydia.
The laboratory parameters of a 19-year-old man are plasma testosterone decreased, FSH and LH are elevated, urinary 17-ketosteroid excretion is decreased. The administration of human
Mm-hmm.
gonadotropin
Tropin.
HCG yeah, did not increase plasma testosterone level or the urinary excretion of 17 ketosteroids.
So,
What is the possible diagnosis? Maybe because the administration of the um, hormones didn't work, it might mean like their his gonads are not working well. Maybe
yes, so that means that's a primary hypogonadism.
hypogonadism
Okay, what
and
can cause primary hypogonadism, especially in man and a young man?
um, maybe administer testosterone.
Okay, that's a bodybuilder, for example. That could be. What else?
Um, maybe mm,
A genetic problem.
yeah. So there's nothing to do about the genetic problem, maybe.
Okay, what kind of genetic problem? That is called the Klinefelter syndrome.
Mm-hmm.
Klinefelter syndrome, when we do have a too many X chromosome, XXY, for example, and it could looks like as a man, but the gonads are not producing enough hormones. But can be, for example, due to viral infections such as the mumps virus or other that destroy the testes. Okay, the
Like inflammation.
cryptorchism can be, but usually they are checking whether testis is distended or not. So these or trauma, for example, somebody grabbed boss, that could be the problem. So a
Mhm.
lot of things can cause primary hypogonadism, radiation or toxicity or too much warmth, for example, heat. That's other bad thing for the testes.
Mhm.
Okay, good,
Okay.
very good. Mate, you are the Superman here. Now,
Yay. So, can you hear me?
yes.
Okay, nice. Laboratory parameters of a 42-year-old man are plasma testosterone increased significantly, FSH and LH are barely detectable, and urinary excretion of androgens are increased. The right testis is enlarged.
Mm-hmm.
Um, so the FSH and LH are barely detectable because they respond to the negative feedback from
Mm-hmm.
the large testosterone levels. So the hypothalamus and the pituitary seem to work fine.
Mm-hmm.
So this has to be a primary hypergonadism.
Mm-hmm. Mm-hmm.
And the urinary excretion of increased excretion of androgens uh, means that there is increased androgen concentration in the blood as well.
Mm-hmm.
So uh, it might be a bit far-fetched, but I was thinking about an androgen secreting tumor
Mm-hmm.
that's in the right, growing in the
Mm-hmm.
right testicle, or maybe the um, the adrenal hyperplasia, because the adrenal cortex can also.
No, I don't think so because your testis, you have an enlargement in the right testis, so that
Hmm.
could be a seminoma.
Hmm.
That could be the seminoma, a tumor that rise from testis, and one thing can be to remove that testis, and that won't be any other problem with this patient. So that's it. That's a hyperfunction. So that's a primary hyperfunction due to a tumor. That's it.
Okay.
Nothing too much. Okay. So uh, okay. So basically.